Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Dr. Leslie Koenig joining us here again, our ketamine therapist. And again, the name of her company is Waybridge Clinics. Go to waybridgeclinics.com, and she really puts patients at the center of everything they do. And we're here today to talk to her and to talk more about the work she's doing and how she's impacted so many lives with this. And by the way, as a doctor, she's going to, of course, share her own experience and journey and what made her find Waybridge Clinics to begin with. How are you?
Hi, I'm good, Jill. How are you?
Good. Pleasure to have you back. I know you're based out of the Omaha area. You have a new location available, it's saying?
Yeah, Omaha now, and I will be going to Nashville to open another clinic by the end of the month. But well, starting at the end of the month to get it rolling, really. So hoping by the end of
Congrats.
the year.
Great. Well, first and foremost, just tell us a little bit about yourself. Would you mind introducing yourself to everyone?
Yeah, so my name is Dr. Koenig. I am a medical doctor. I'm board certified in emergency medicine, so I've been using ketamine my whole career. And I opened a ketamine clinic called Waybridge Clinics last year. And we've been seeing tremendous results since we opened for depression, anxiety, PTSD, and chronic pain.
Perfect. And what made you get into this? Obviously, as a physician, what made you discover the benefits of this? I guess you were probably seeing they were overwhelmingly helpful, right?
Well, yeah, in the emergency room, I was using it primarily for sedations. But when I was doing my training with the military, I was in the Navy for 8 years. We used it for pain as well. So when I moved into the civilian world, I instituted it at the ER and saw
Mm-hmm.
amazing benefits there, where traditionally we use a lot of opiates to deal with pain. But I found that it worked very well for other things as well, with chronic pain and mood boosting effects as well. And then I saw the data about it, and here we are.
Yay. Well, thank you for being here. How do we contact you? Would you mind sharing the website, phone number, anything of the sort?
Yeah, absolutely. It's waybridgeclinics.com. That's with an S at the end. And our phone number is 402-965-1371.
Perfect. And I know for today, we're going to kind of debunk some myths, right? So we're talking
Yeah.
about ketamine therapy for mental health, myth versus facts. So let's get started. How effective is ketamine for depression and anxiety?
Well, so that was the big thing that I had a trouble with to start with. It when I looked at the data, it's almost too good to be true because it works so well. Almost 80 to 90% of our patients experience significant benefits
Mm-hmm.
within hours to weeks, which
Wow.
was far more than any medicine I'd ever seen do. So ketamine is incredibly effective, and it can work. It works very well to start with, and it continues to work through each one of our foundational sessions. We do 6 sessions, and many patients experience benefits at each session, just kind of continuing along and along. So within 1 month, patients are different people and their symptoms have dramatically reduced. So it's incredibly effective.
Amazing. And are there, naysayers out there that say it's not effective? And I don't, I've only heard positive. So could you just share a little bit about what the other side's saying?
Yeah, I think the naysayers, gosh, they can't argue with the data. I'll put it that way.
Okay.
The naysayers find other ways to discuss any concern they might have, which I'm happy to discuss. But in terms of the efficacy, I mean, like I said,
Mm-hmm.
80 to 90% effective. And
Wow.
I guess a naysayer, they might point towards some other concerns about is there a placebo effect? How long does it last? Because you can't argue with the data. And
Yeah.
so the question is possibly how long does it last for? And that's an individual thing for which that's why we offer boosters that can sometimes be just every few months. And so you don't have to take a pill every day, but you experience the benefits for quite some time, like years even. And some people don't need to come back.
Got
So
it. Oh my
yeah,
gosh. All
it's
right.
super effective.
Thanks for sharing that. And what about, let's talk about the misconceptions of, ketamine therapy, I guess.
Yeah, I would say that there's probably 3 big misconceptions that I hear. The biggest one is its use in veterinary medicine. That's one of them. And another one is about some of the stuff in the news with Matthew Perry and the
Mm-hmm.
misconceptions around that. And then other misconceptions are about street use or illegal use of ketamine. So to address those 3, to start with the veterinary medicine
Yep.
question, So ketamine, yes, is incredibly safe. And that's why it is used in veterinary medicine. And I myself used it on the battlefield. The thing about it is that you can give it to someone or an animal in distress and not have to worry about some of the decreased breathing effects, which
Okay.
is why it's utilized in veterinary medicine as well, because it is so safe. And then on the battlefield, we used it for that same purpose. And so people wonder about that, but the fact is that the veterinary medicine found like what benefit it was. And so they
Yeah.
adopted it for themselves as well.
Got it.
And that is one misconception is this is 100% safe in humans. And literally every hospital around the nation and the world utilizes ketamine as part of their surgery suite. And anesthesiologists use it regularly. So it's a very widely used medication and completely safe in humans.
See,
And
good to
then the
know.
second misconception about Matthew Perry, and he was in a home environment, and it's actually quite tragic what happened there. And he was kind of a medically enabled addict. He had some physicians who did not have his best
Mm-hmm.
interest in mind, which is unfortunate, and that's gotten
Yeah.
a lot of bad press and really overshadows the true healing properties this medicine has. So that's a big misconception is it legal also with the recreational use. So people find that with ketamine, there's a
Yeah.
bit of an escapist fat like area to it. And they use that on a abusive way to kind of escape their lives. And that's again unfortunate. But the thing is that ketamine is an incredibly powerful medicine and needs to be used with a responsible prescribing physician.
Perfect, which is what you are. Just for those that don't know, could you just share a little of your background? I know you touched upon it when we started, but it's always good to hear for the new timers out there who are wondering, wow, this woman's very educated. Where's she getting information from? Well, could you share just a little bit about, how you started out?
Oh yeah, so I've been an emergency doctor for gosh, over 12, 14 years. Um and I as an emergency doctor, I spent 8 years in the Navy and I've done another half of that here in Omaha. And again, using ketamine in the emergency room. In the emergency room, I see everything. I see heart attack, strokes, but a huge part of that is the mental health aspect that comes in. I've seen suicides, I've seen overdose, I've seen
Yep.
all kinds of trauma, and have had to respond to all of these with the tools in our toolbox, ketamine being one of them.
Interesting. And that is where you found, I mean, obviously there's so much to be done with this because I've heard, like the naysayers, you hear the negative, you hear the Matthew Perry stories, the overdose, but is the same ketamine being used by, properly by the ones on the street, or are we talking all the ones on the street are like contaminated? What's happening with that? Just curious, because is it really the same ketamine that people are talking about?
That's such a great question. So the ketamine that we use in clinic is, we purchase it from a pharmacy. It is the generic ketamine that has been FDA approved since 1970 for anesthesia.
Okay.
And we utilize an IV form because is 100% bioavailable. So that makes it kind of the highest standard of giving this medicine for the most healing. Other forms of ketamine out there are other clinics utilize they use the same form of ketamine that have both what we call enantiomers or kind of parts of the chemical, an R
Okay.
and an S. And another question I get about is what kind of ketamine do we give? We give the original FDA approved in the 70s. There is
Perfect.
another form of ketamine out there
Oh,
that's a nasal form called Spravato.
really?
And that,
Okay.
yeah, that only utilizes kind of half of what we give. They use the S ketamine part. So there's R and an S. It's like a 50-50 mixture. We use the mixture, which is again since the 70s. But they pulled it apart and
Yeah.
put the S part in a nasal spray and call that Spravato.
Really? Wow.
Yeah.
See, you taught me something new today too. All right. Thank you so much. Let's continue the conversation and talk about, well, risks, right? Are there risks associated and side effects with ketamine uses?
Yeah, no, I'm so happy you asked. I mean, yes, ketamine is a medicine, and we always want to discuss risks, benefits, and alternatives whenever we do any kind of intervention or
Hmm.
therapeutic medication. So the risks of ketamine, most of the time, the side effects, for the most part, are some nausea during the infusion, for which in our clinic, we know this, we anticipate this, and we give a very easy to take nausea medicine. Also, ketamine can increase blood pressure and heart rate, which is
Mm-hmm.
why we do constant IV monitoring in the clinic.
Okay.
And most of the time, respirations or breathing rate, how often you breathe, will go up a little bit.
Mm-hmm.
And I just want to counter that from, for example, Oxycontin, Percocet, hydrocodone, Dilaudid. All of those will lower those parameters of your vital systems. Ketamine kind of does the opposite, which is why, as a Navy combat physician, we used it so much on the battlefield, because it raises blood pressure, raises
Yeah.
breathing rate, raises heart rate.
Mm-hmm.
And so those are some of the side effects we just wanted to monitor, because in case it goes too high, we can mitigate that treatment, or respond to those side effects. Most people feel the need to go to the bathroom. The medicine itself can directly have the bladder kind of spasm a little bit.
Okay.
So a patient, yeah, that's one thing that we want to have patients come in with an empty bladder and an empty stomach.
Good to
And then
know.
some of the bigger ones are, a lot of people will find that there's not much information about the experience of what happens during the infusion. The experience, it's called a side effect because the brain goes into a state of non-ordinary consciousness, or the mind dissociates a bit from the body. And so at the doses that we do, people will experience that kind of side effect. But honestly, that's another thing to be prepared for, because there's a lot of healing in that space of that non-ordinary consciousness with a dissociation that happens. So kind of discussed as a side effect,
Okay.
but something to absolutely be aware of, because it's a beneficial side effect, or it's
Wow.
just one of the ways the medicine works.
Got it.
And then there's some other ones where if you're predisposed, it can lead to some bladder issues. Usually that's at very high doses, far more than what we do. So, but
Interesting.
those are questions that we tend to want to continue asking every time.
Got it. And just curious, when I've had some surgeries, right? And like most recently probably was my hernia surgery last year. And I believe again, the doctor gave me the ketamine, right, to go to sleep. But how come you feel so relaxed? That state of relaxment afterwards, right? Let me ask. That's something that is just it feels so good, right? Now, could that become addicting for someone who really wants that feeling? Is that a good thing to be addicted to that feeling? Do you know what I'm saying?
Yeah, no, absolutely. And with surgery, often, thank you for sharing your story. And for surgery, anesthesiologists will often give a combination of
Yeah.
medicines. And ketamine that does give that often feeling of peace
Yeah.
and a relaxation from that depressive symptom. And so it's more like, with the depression being gone, people
Uh-huh.
very much enjoy feeling, quote, normal,
Yeah.
or the feeling that unburdening of their depression. And it's not so much that that's addictive, it's more that that is the state that they've been trying to look for through all these medicines for years and years and years.
Got
And
it.
so it's kind of like, when you find that peace and you find that weight
Yeah.
lifted, you find the motivation to live your life, that's something that is very attractive to continue, which is why we utilize that to put in the lifestyle changes, the antidepressant effects of, say, exercise or going out with your friends, seeing your family. And those are things that, well, the ketamine pulls you out of your depression, but the lifestyle changes that you make, like going to the gym, for example, or paying attention to nutrition, will
Mm-hmm.
actually become better habits now that you have the energy to pay attention to that.
Got
And
it.
so that relaxation afterwards kind of plays into the next step. And that's why, again, it's so important to have someone guiding you through all of this, so that
Mm-hmm.
we can say, at what point has the medicine done its therapeutic healing value, and moving on to something else to heal yourself.
Got it. All right. Thank you so much. And also, is there any other side effects you want to talk about before we continue?
Hmm. No, I mean,
All right.
most of the side effect, I hate to say it, but one thing I didn't anticipate when I opened this clinic, so it's a bit of a side effect as a doctor seeing this, is how many patients experience added healings that I didn't
Oh,
really see at the outset. And for that, I want to say, like, healed relationships, People look to heal, people look to fix their depression, or look to fix their PTSD, or look to fix their anxiety. And what we're finding is patients come back saying that all kinds of other benefits came on, like their shoulder pain got better when they came to see me for back pain, or their irritability was affecting their relationship with their kids, and yet now their marriage is far better, or they're able to focus at work better. So it's something where we think of side effects as being a bad thing, but in this way we have some positive side effects, which is something that I do not want to overshadow. And spiritual healing as well. A lot of patients will feel that they are able to get deeper and see more perspective in that realm of their life as well.
All right, thank you so much. Also, let's move on over. We still have a few more minutes to talk about maybe some of the other treatments in comparison, right, for mental health to ketamine.
Oh yeah, so I touched on Spravato earlier about being the nasal spray, and many people have heard of that because it is patented now and therefore insurance covers it. And so just to highlight the difference between ketamine and Spravato is that ketamine is off-label, Spravato is labeled for depression. However, what we do encompasses what Spravato already does, but with a higher bioavailability. That being a nasal spray, it's only like 60 to 80% tops
Okay.
available. Yeah, and then what we do IV is 100%. So what we do is more available to the brain where you want that medicine to see, and also we can tailor it to the individual. So that's where it's better. And then even contrast that to the oral form of ketamine. There are mail order ketamine pills or tablets or troches out there that people may have heard of, and you'll notice that it's a cheaper option,
Got
but you
it.
also don't get the tailor-made dosing. You also don't get a physician to help you with the actual prescribing of it or holding space if there's something that occurs, and you don't have anyone monitoring your vitals. So that's some of the kind of ketamine versus what we do IV versus the other options. And then, of course, there's traditional treatment, which is like the SSRIs, SNRIs, antipsychotics, anxiety medicines, and those are all pills that work on an entirely different part of the brain. So from a
Okay.
neuroscience benefit, you have to keep taking them. Ketamine
Got it.
doesn't work that way, in that ketamine is one of those, we hopefully see you for a handful of sessions, ideally 6, and then your brain actually grows new connections and you don't need to see us again. That is so different than everything else on the market.
Yeah.
Another thing is that ketamine is the only medicine that drops suicidal thoughts within hours. Everything else has a little black box warning. If you
Hmm.
read the fine print, taking this pill, you may notice increased suicidality. With ketamine, you
Ooh.
don't. Ketamine actually treats it. I've given it in the ER for suicidality and was able to discharge the patient instead of to a psychiatric institution.
Wow. Seems like there's a lot of benefits to this.
It sounds too good to be true, and I promise you it's not. The more that I learned and the more that I educate people,
Mm-hmm.
um, it's really phenomenal. It really is. It truly changes lives.
Wow. Now, let me just ask, this is used for, can anyone have access to this if they're under a doctor's care? If they just want to try it? Or no, you have to have a medical condition. Just curious how that part works. People are interested because it sounds so good.
That is a great question, and I do get this, and I understand how that I understand that. I truly do. The fact is that the ketamine research really is on depression, anxiety, PTSD, and as a medical doctor, we're here for healing.
Yep.
And someone who doesn't need to be healed of those things, ketamine may not be the best option. For people
Perfect.
who are looking for spiritual exploration, I'm all for other forms like meditation or going on retreats. There's so many different ways to do this, but ketamine truly should be used for its indication, which is depression, PTSD, anxiety, chronic pain.
Perfect. Thank you so much. All right. We still have a few minutes left. What else did you want to talk about? Any other myths that need to be debunked today?
Other myths that to be debunked is that insurance never covers this. I
Okay.
will say that we have had some success with insurance partially covering our
Okay.
treatment. Now, that is something that every individual clinic or doctor running the clinic has to really fight for. And that's why I am hoping to change this, insurance by insurance to fight for how we can person by person and finding ways to get this covered and paid for by insurance. In addition, I
Mhm.
mentioned PTSD and a combat veteran, and I am passionate about helping our veterans, being a combat veteran myself. And for
Oh,
that reason, I was able to get an agreement with our VA here in Omaha. And so therefore, anyone in this catchment area of that VA, the Midwest region,
oh
can
wow.
come to, yeah, just it is covered by the VA. You just have to see which clinic might be part of the care in the community network and get a referral
Mhm.
through the VA. And there, I get so many questions on this. I'm happy for people to reach out to us on our website to know more.
Perfect. And what is the website?
Waybridgeclinics.com.
Perfect. And in closing today, how did you want to leave off? My goodness, great show.
There's so many questions about ketamine. I'm happy. I hope I answered a few of them. Ketamine is an amazing medicine. Ketamine has so many possibilities for healing.
Yeah,
And I just wanted to talk about some of the naysayers or some of the big questions that deter people. But I want to let
sure.
you know it's entirely safe, physician-led, and evidence-based.
Perfect. Thanks so much. If we want to reach out if we're in the area, one more time, tell us how we could do so.
You can give us a call at 402-965-1371. But the best way is our website, waybridgeclinics.com.
Awesome. Thanks so much. Pleasure having you here. And unfortunately, we got a little bit of a late start, and hopefully we'll have more time next time to speak. But thank you for this and for enlightening so many. Also, are we back on next week?
I believe we are.
See you then. Sounds
All
good.
right.
Thank you
See you
so
then,
much,
Jill.
Dr. Leslie
Thanks.
Koenig. Bye bye. Thank
Bye.
you.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.